Hey, gorgeous. Welcome to Season 2 of the Hormone P.U.Z.Z.L.E Podcast. I'm your host, Coach Kayla Smith, CEO of the Hormone P.U.Z.L.E Society, a women's health hub for fertility, hormones, and the business of coaching, creator of the Hormone P.U.Z.L.E method, an infertility warrior, two-time boy mom, and women's health expert. This podcast is for women struggling with infertility, painful periods, terrible PMS, or really just any symptom of hormone imbalance that they are ready to eliminate for good. Tune in weekly as we interview amazing experts in the fields of women's health, breaking down those hormone walls, nerding out on nutrition, and having way too much fun. Whether you're beginning your journey or you've been struggling for years, we're going to finally help you put those pieces of your hormone puzzle back together so that you can get pregnant and eliminate those pesky symptoms for good. Are you ready? This season is packed with even more expert guests sharing groundbreaking knowledge, giving you that jolt of energy that you so desperately need, sending you lots of virtual hugs, and inspiring you to take your fertility into your own hands and make that baby. Thank you so much for tuning in. Now let's get started on your road to transformation. Today's guest is Dr. Alan Christianson, a board-certified naturopathic endocrinologist who focuses on thyroid care. He is a New York Times bestselling author whose recent title includes The Thyroid Reset Diet. Dr. Christianson has been featured on countless media appearances, including Dr. Oz, The Doctors, and The Today Show. He is the founding president behind the Endocrine Association of Naturopathic Physicians and the American College of Thyroidology. Listen in as we talk all about thyroid, his thyroid reset diet, and how you can reverse thyroid disease and many autoimmune conditions. And spoiler alert, it's easier than you think. You're definitely not going to want to miss this show. So without further ado, let's welcome Dr. Alan Christianson to the show. Today's episode is presented by TwoPlus Fertility, a comfortable and easy to use at-home device that increases the chances of a sperm meeting an egg when you're trying to conceive. When you try naturally, less than 1% of sperm reach the egg. TwoPlus Fertility's goal is to fix that. For more information, visit twoplusfertility.com and use code KAYLA30 at checkout for 30% off your order. Hey, Dr. Christianson, thanks for joining me. Welcome to the show.
Hey, Kayla. Thanks for having me. Glad to be here with you.
I'm excited to have this conversation.
Yeah, I'm glad you do your work. Fertility is a huge concern for people, so thank you for that. I'm happy to add any insights I can for them.
For sure. So let's dive into your story a little bit. Kind of tell us how you got here and how you started working in women's health.
Well, it was probably going to be astrophysics. That was the first plan. That was my biggest passion early along, but my own personal health rerouted me. And I realized how many people just struggle for basic lack of knowledge. I had complications from cerebral palsy. I had seizures. I was an epileptic kid. And I couldn't really do sports or physical activities. And I gained a ton of weight. And as an adolescent, I was in a pretty dark place from that. And, I don't know. There's still certainly such a thing as fat shaming, but when I was a little kid, there wasn't a term for that because that was just normal. It was just expected, right? Yeah. So, and I put aside some of the space books and got into some of the health books and fits and starts, but it changed my life. I was able to improve a lot of things and I saw how the world changed socially and in all ways from that. And I realized it was information that did it, and it drew me into going into medicine. I knew that lifestyle was important. I went into natural medicine. And then in my residency, I saw women struggling with thyroid disease. And they had a lot of the struggles that I had, but lifestyle wasn't working for them. They were doing all the right things, but they were making no progress. And I would see them try conventional approaches or natural approaches, and it was all really hit or miss. So it became just a strong passion to help do a better job for them. And that was almost 30 years ago, and still at it.
Oh, I love that. Yeah. And I find so many of us, that's how we get into this work. Our own struggles kind of lead us here. So it sounds like that was
selfish reasons.
That's right. That's right. I want to fix myself, and then I want to show others how I did it. I love that. So let's talk a little bit about thyroid. I know that's, your specialty. So talk to us more about that. How does that play a role with our fertility?
Yeah, big thing. So overall context, thyroid disease, we've got diseases of the gland structure. It gets big, nodular, goiterous, cancerous, diseases of its function. It makes too much to a hormone. And then diseases of inflammation. The immune system attacks it. Thyroid hormones are the most microscopic things that control every cell head to toe. Hormones in general are all important. I'm an endocrinologist by training, so they all matter. But they work via receptors. So if a cell has a special lock that a hormone can fit into, it will respond to it. There's only one type of hormone that every cell has receptors for. That's thyroid hormones. So head to toe, they affect everything. How fast we burn fuel, how well we repair our tissues, how well the other hormones work, how well nerve signals are sent throughout the body. And over the last 3 decades, thyroid disease has more or less tripled. Thyroid cancers have, rates for thyroid diagnosis and treatment have, and they squarely affect women, and especially women around the reproductive years. So every time a woman goes through a big hormonal change, there's a chance that can disrupt thyroid function and trigger the disease. So pregnancy, moving into it or out of it, fertility struggles, perimenopause, menopause, those are the times where it really starts to show up, and it's tripled. And as far as fertility goes, this is something that's a convergence between the slower, dogmatic, conventional world and what we know about science and thyroid disease. So, like a lot of things, the thyroid is not so much working perfectly great, and then overnight now it collapses. There's a continuum, right? And we see this evidently very clear in fertility. We know that women can have normal thyroid function, but on certain sides of that, not be successful with conceiving or maintaining pregnancy. And along those lines, too, we even know that even with no problems of thyroid function, just the process of autoimmunity against the thyroid, that by itself can also affect fertility. So yeah, lots of strong ties in that way.
For sure. And why do you think that is? We're seeing so much thyroid disease now versus 20 years ago.
Well, simple answer is iodine, in all honesty. So the researcher who did the latest meta-analysis on what causes thyroid disease, he said that there's basically 3 irrefutable factors, age and gender. The first 2 we can't do a whole lot about. The third one is iodine. And his conclusion was that it's not the only thing that triggers thyroid disease, but it's more relevant than all other things combined. And it's the only one that we can actually do something about. So we now have multiple human trials showing that through dietary iodine regulation, roughly 80% of adults with ongoing thyroid disease can fully reverse disease. And roughly 45 to 50% of adults who are on thyroid treatment can reach a state in which they have normal thyroid function and do not need thyroid treatment and are asymptomatic. So there's just been shockingly powerful new data about this over the last few years.
Wow, very interesting. So how do we know if we have an iodine deficiency? We go get tested.
Well, so it's not about deficiency. It's not a problem of deficiency. It's a problem of excess with thyroid disease now in the modern world. So if we go back prior to this 30-year window that I mentioned, we go back to 92, we had 112 nations on planet Earth that were categorized as severely iodine deficient. Now, if we go from 92 to 2014, that number drops to 0. We now have 0 nations on planet Earth that are categorized as severely iodine deficient per the World Health Organization. However, we have 52 nations that are categorized as at risk for thyroid disease due to iodine excess. Wow. And the United States is one of those. And we look at subpopulations per age, gender, and ethnicity, and we see that most women of reproductive age, I shouldn't say most, but yeah, most ethnicities, most age categories show about a 30 to 40% rate of being at unsafe levels of iodine. And that doesn't affect everyone. Many people can be exposed to varying amounts and do fine, but they're not the ones prone to thyroid disease. Those who are cannot tolerate the slight excesses.
Interesting. And so where are these excesses coming from? From just our
Yeah.
food supply? They're adding iodine to things we're eating on a daily basis?
Yes.
Yeah.
So
Interesting.
the main sources are dietary, they're topical, and they're also supplemental. So dietary sources, there's many that have been rather static that have not changed much. And that would include things like egg yolks, seafood. Sea vegetables have a ton. Most Americans don't eat much of. They don't contribute a lot to the average American diet. However, the two food categories that comprise 80% of iodine intake for Americans are dairy and processed grain products. And the amount in those foods, so 23 of the top 25 dietary sources of iodine, their content has tripled in these last couple of decades. So yeah, it's gone way up. And the threshold is somewhere around 200 micrograms. Most can safely tolerate up to that. But the further we get above that, the more apt we are to be pushed into thyroid disease. So dietary, salts, iodized salt, pink Himalayan salt's popular in natural health nowadays. It's twice the iodine as iodized salt. It's unsafe levels for most people. And then we see iodine in cosmetics. In natural cosmetics, that's called kelp extract or sea vegetable extract, and that does absorb topically. The FDA removed it from hand sanitizers in 2018 because of too many hospital workers developing thyroid disease. But yeah, hand sanitizers, skin, personal care products, they're sources of that as well.
Interesting. So that was my next question. So we can absorb it through our skin. So we need to be looking to see if we're using these products that contain this.
Yeah, so the Thyroid Reset Diet, I've got a listing of iodine ingredients, and personal care products. In most common conventional personal care products, it's called PVP, is the main iodine compound. In natural ones, it'll be called kelp extract or sea vegetable extract. And it's an incredibly useful ingredient. It makes creams smooth, it makes them not go rancid, and it does good stuff, but we absorb it topically, we absorb it orally, we even breathe the stuff in. That's not a big source for most people, but if you live next to an area with like a lot of kelp beds, then yeah, you actually do breathe a fair amount in as well.
Right. And so would you suggest that we be tested for this? We wait until we show signs of a thyroid disorder? Like, where do we start with that?
Yeah, that's the most logical question. Is you would think that. So the difficulty is the testing doesn't predict response. So iodine has a compartment inside the thyroid, which is distinct from the iodine in the blood or the urine. So I mentioned how some studies showed that people could regulate their iodine and reverse thyroid disease. Some of those studies tried to be more predictive and test people in advance and say, okay, maybe those who were highest would get better results, those who were lowest would not. It just didn't work that way. The iodine levels, whether through blood or urine, didn't predict the response. So really, if someone's in the modern world, their safe assumption is to look at regulating iodine and watching if they have thyroid disease and watching to improve their thyroid function.
Gotcha. And so how quickly can that be done? Say we are showing some symptoms of thyroid, maybe not disease, but maybe some thyroid issues. Maybe we've got an autoimmune that's starting to pop up.
Full-on thyroid disease can be there as well. So one of the classic studies on Hashimoto's took people that had Hashimoto's for about 5 years. Just to back up a step to give a perspective on the severity of their disease, we think about thyroid function via various blood markers. One of the central ones is the TSH. And you probably know this, it's a backward marker. So the higher it is, the more underactive one's thyroid is. And you can argue that when that number gets even in the normal range, when it gets above 2, some people can start getting symptomatic. They cannot do well from that. And most normal ranges go up to about 4.5. Well, in this study, the average TSH score was 14.1, and many had TSH scores of 100 or 200. They were severely hypothyroid. And for 3 months, they did only one thing. They cut out some of the basic iodine sources in the diets. And within 3 months, 78.3% of people had completely normal TSH scores. They averaged at 3.1. Of those who did not improve, one group was simply not compliant. They were still consuming a lot of iodine, so they don't count. The other group, they were improving radically, but they were not yet normal. So their TSH average went from the 1 to 200 range down to the 20 to 40 range. So had they been given more time, they could have gotten better, but they weren't there yet. So as far as how many failed to respond, how many did do it right and failed to respond at all, that was about 3%. And we've seen this from multiple studies. So like 90 to 95% of people improve, and a big chunk of them completely go into remission in a matter of months. It's completely unprecedented.
Wow, that's amazing. That's amazing. So let's talk a little bit about myths. What are some myths that you hear around thyroid? And let's kind of debunk a couple of those.
Oh boy, heck, lots of them. I guess big things are that, well, it's underdiagnosed, so half of those who have it have not been diagnosed with it. Common guidelines often do diagnose it when it's only been present for a decade or more. So if someone does suspect it, and we think about this for persistent symptoms, big ones being unexplained weight gain, difficult weight loss, unresolved fatigue. Certainly infertility can go in this category. Diffuse, even thinning of head hair, menstrual irregularities, anxiety, depression symptoms, chronic irritable bowel syndrome. Those are the top few. So if those things are there for no clear reason, one should suspect thyroid disease. So that's one big myth, is just underdiagnosis. And the other big one is just undertreatment. Those who are on treatment often do not improve, and they think that that's not possible. So yeah, the myth is that it is possible. And along those lines, a big one is that people need treatment forever. So one study looked at those who were on medication and had been on it for more than 5 years, and it gave them very cursory recommendations for iodine reduction. And within the course of 2 months, 80% needed less medication, and of them, 45% needed none, and they were stable and asymptomatic. So people can get better from thyroid disease. That's the biggest myth. They can't.
Wow, that's amazing. Incredible. So we're going to take a short break. We're going to hear a word from our sponsors, and we're going to come back, and I want to dive into some practical tips on how we can optimize our thyroid. I want to talk about your Thyroid Reset Diet book and talk a little bit about food. So we'll be right back. Hey y'all, it's Coach Kayla here. I hope you are loving this episode as much as I am. We will be back in just a minute, but first, a word from our sponsors. Happy to share the sponsor of today's episode, TwoPlus Fertility, which was designed to help solve the issue of less than 1% of sperm reaching the egg when you're trying to conceive at home. Comfortable and easy to use, each device, which is as seamless as using a tampon, can be used up to 4 times a month. It's soft and comfortable, drug-free, and made of 100% medical-grade silicone. TwoPlus believes that every drop counts and encourages users to insert TwoPlus Sperm Guide before sex in an effort to stop sperm from flowing back out of the vagina post-sex. TwoPlus wants to bring as much sperm to the right place in the vaginal tract and create an experience that can be tried from the comfort of your own home or hotel room. Learn more about this product, which can be discreetly shipped to your doorstep by visiting twoplusfertility.com. Available in the US, the UK, and Singapore. And don't forget, use code Kayla30 at checkout for 30% off your order. Hey, Dr. Christianson, welcome back.
Hey, Kayla. Good to be back with you.
For sure. So let's dive into some practical tips. We talked about this a little bit in the first half, but let's just go through maybe 3 things that we can do to really optimize our thyroid.
Yeah. Easy thing, really the most relevant steps are all going to be iodine regulation. And I'll talk about big ways to do that. We have roughly 30,000 human studies on its relevance. We have a handful of studies on anything else. So it's the biggest single factor by far. First thing is salt. That's the easiest thing to regulate by far, because you don't have to give up salt. It's not so much sodium that's an issue, but some versions have a lot of extra iodine. Denmark was the most recent nation to fortify their salt with iodine. They did that in the year 2000. And for 17 years afterward, they saw an average increase of thyroid disease of about 50% per year. And they fortified by the tiniest amount, just like 50 micrograms per day. Wow. So doing iodine-free salt is easy, it's painless. And the cool thing is that most chefs already recommend that because there's a bitter taste from iodine. So My favorite is kosher salt, and my very favorite brand is Diamond brand kosher salt. And this is also something I realized, first I thought about sea salt, and I've always thought that was a cool idea. The idea behind that is that you get more minerals from that. But then I thought through, well, how much minerals are we getting from sea salt?
Right.
So it's got potassium, calcium, magnesium, zinc, iron, but how much? And when you get down to the quantities, it's not enough to make a lick of difference. Like a leaf of spinach has dozens of times more minerals than any of those things from salt, right. Or like a blueberry, So I realized salt is not a vitamin. It's something that flavors your food. You want certain culinary properties. So I thought about just emulating the best chefs. And yeah, Diamond brand, I'm not tied to any of these companies, but their shape is such to where it does a really good job sticking to foods and flavoring things real well and gentle, and it's iodine free. So that's an easy one.
Good. I love that. And so to go back a little bit, so you would stay away from the pink Himalayan salt. That is not good for us.
Well, so the drawback is the iodine content. So yeah, the window to prevent thyroid disease is probably about 50 to 200 micrograms per day. And the window to reverse thyroid disease is somewhere under 100 micrograms per day. Pink Himalayan salt, if you're averaging about a teaspoon of salt per day, like most people do, that'll give you about 560 micrograms of iodine just by itself. So it's over 2 times above a safe upper limit for anyone, just with nothing else there.
Wow, interesting. Yeah, because you hear, it's good for you, but I guess not. Not for our thyroid. So talk to us a little more about your reset, the Thyroid Reset Diet. What does that look like? And kind of give us some foods that we might find in there.
The cool thing is that it's basically, I encourage certain foods, but it's really more about just not overloading iodine. I spend a lot of time generating lists of iodine content in foods. You don't find that. You can go to like nutritionfacts.org, or you can go to Chronometer, or you can go to the FDA's website. You won't find lists of iodine content in foods. Like MyFitnessPal, it's not there. You got to dig really deep. And the problem is that the amount varies tremendously from batch to batch. You can buy a loaf of bread in the supermarket right now, and if you were to assay the iodine content per slice, you can find one slice with like 40 micrograms, and the slice next to it with like 1,100. I'm just not making this up. That's been done. But yeah, it's all over the map. So I compiled a list of over 600 foods, and each one I had about 50 samples to average. And I knew what the safe targets were. And so the foods that occasionally had whopping amounts, I still considered unsafe because they might throw someone off. So the whole reset diet is just, I put the foods into green light, yellow light, and red light. Green light, they're not no iodine, but you're not going to get above target by eating those foods. Yellow light has moderate amounts. Red light has just too much to be safe for those prone to thyroid disease. So the whole reset diet is eat green light foods. I did talk a lot. There are some other data points about how a good balance of all the macronutrients is helpful for your thyroid, how selenium is important, zinc is important. So I covered the bases in a lot of ways to make it just a well-rounded diet overall. But the main action step, like the studies that I cited, all they did was cut out the big sources of iodine. They did nothing more than that. And like 80% of people were better in a matter of months. So that's the most important part. And yeah, the green light diet, every food category you can think of has a lot of options. So if you're vegan, you're AIP, you're paleo, you're whatever it is, you can still do that. Just, eat these green light foods and avoid the red light foods. It's that easy. And once your thyroid function's gotten better, then I guide people into how they transition into the maintenance phase. And all that is you're welcome to add in 1 or 2 servings of yellow light foods if you wish, if there are things that you've been missing.
Interesting. And so what would some of those yellow light foods be?
Dairy foods go in that category. So there can be a benefit to like some unsweetened yogurts or some healthier cheeses or milk or whatnot, or egg yolks. They can go in that category. So there are things that are, they can have a role to play for some people if they're not intolerant of them, but they've got moderate yet consistent and predictable amounts of iodine. So if someone is in their maintenance phase, now they got leeway up to about 200 micrograms, they can add some of that back in. There's also many types of seafood that are too high in iodine, but when someone's on maintenance, they've got a larger palette of seafoods to choose from.
Interesting. Sounds very easy and wonderful to follow. So let's talk about exercise. How does exercise affect our thyroid?
Yeah, good thing overall. Again, the studies I cited, they weren't exercising. 80% of them got better in a couple months. So I can think of a million reasons why exercise is good for us. And there actually are some papers showing that those with thyroid disease and unresponsive fatigue, they see radical improvements on even just the most meager amounts of exercise. So yeah, general overall health, brain function, disease risk, I couldn't encourage that more. And in this book, I didn't go deep into that. In the prior one, I did talk more about the idea of having a nice balance of regular aerobic training, some strength training, some flexibility type work, and what that would look like. But yeah, wonderful thing.
Love it. Love it. So the bottom line is watch the foods you're eating that have iodine in them, stay away from the red light foods and go towards the green light foods and moderate exercise.
It's so crazy simple. But yeah, so what happened was they've done low iodine diets for various types of medical procedures. So if someone's going to do an iodine uptake scan or radioactive ablation, they have to make their thyroid hungry for iodine. You've got to go low iodine going into it. And many were observing that in doing so, people had spontaneous improvement in their thyroid function. It was being seen over and over again. So they wanted to do clinical trials to see if this is something that could actually be done in a controlled way. And yeah, we've had now 4 large studies on Hashimoto's, hypothyroidism, subclinical hypothyroidism, and then those on thyroid treatment. And they've all shown pretty much the same thing. The results have fluctuated from like 65 to 80% of people are completely normal within 2 to 3 months based upon the study. So it's crazy effective.
Yeah, that's amazing. Oh my goodness, that's so amazing. I love it. So talk to me a little bit more. Where can we find you? Where can we get your book? Where can we learn more about this, the Thyroid Reset Diet?
Yeah, the book, anywhere you'd get books. For most of us, that's Amazon, but also it's available in the bookstores. Give your actual bookstore some love if you can, if there's still one around. But yeah, it's a hardcover, Kindle, and Audible, so whatever format. And finding me, Dr. Christianson, if you put in just Dr. Christianson with some close spelling, you'll come across that. And that's where I'm active. Practitioners, just an exciting thing. There's a group called the American College of Thyroidology. This is a nonprofit. It's a 501c3 charitable organization. And I've pulled together conventional and natural thyroid specialists, nutritionists, surgeons, doctors, researchers, clinicians. And we are a training consortium. And we want both sides of the medical world to raise the standards of care for thyroid patients and help serve them more effectively. So yeah, if you have interest in going deeper in that yourself, please check out actthyroid.org. We're a nonprofit. We offer training and support and case studies. And yeah, we'd love to have more people join with us.
For sure. And we'll have all that in the show notes. I love that. It's wonderful. And so any final thoughts you have for us before we close out here? Any words of wisdom or advice?
I guess the big thing is just to, have the space in your mind about things getting better. You just know that the body can improve itself. And I've believed that for a long time, but I'm still just pleasantly surprised at how powerful that is. How much the body can get better when it gets the right circumstances. And the biggest factors now are the things we have control over. Our diet, our lifestyle, our movement, our relationships, our emotions. These things are huge, and we can do so much with that. So I encourage everyone, listen to what Kayla's saying and follow the advice and know that improvement's possible. Don't give up hope and stay with things.
For sure. I completely agree. I love it. So thank you so much, Dr. Christianson. It's been an honor to have you on the show. So thank you for being here.
My pleasure. Thank you for having me.
And thank you guys for listening to the Hormone P.U.Z.Z.L.E Podcast. Until next time, bye for now. Don't forget to check out today's sponsor, TwoPlus Fertility, a comfortable and easy to use at-home device that increases the chances of a sperm meeting an egg when you're trying to conceive. Visit 2plusfertility.com to order yours, and don't forget to use code Kayla30 at checkout for 30% off your order. Hey, hang on just 1 second before you go. I want to make sure that you are aware of all of the amazing free resources that I have for you on my website at CoachKayla.com. from a fertility meal plan, a cycle syncing quick start guide, a holistic healing cookbook, as well as master classes, blog posts by me and some amazing experts in the fields of fertility, hormones, and nutrition. So many wonderful resources that will help you on your journey. And I wish there had been something like this when I was going through my 2 years of infertility, but there just wasn't. And so that's why I decided to create all of this for you. So make sure that you go and check it out and you take advantage of this plethora of support that I have provided for you. And spoiler alert, these were some of the same tricks and the same foods that I used to get myself pregnant, not once, but twice, even after my doctors said that I couldn't. So I know that these things work. So make sure you take advantage of that. And I cannot wait for you to be my next success story. So thanks, love. See you soon. Thanks for tuning in today to the Hormone Puzzle Podcast. Check out the show notes for today's episode at CoachKayla.com. If you like what you hear, please subscribe and leave a review. Thanks for hanging out with me, and I'll see you next week.